Hi everyone, I'm Dr. Terence Tan from Halley Medical Aesthetics. So today I'm really excited because I'm going to have my Ultherapy treatment. So as you know, a lot of people come to our clinic for Ultherapy treatment, and while a lot of them are really excited about the treatment, frankly speaking, quite a lot of people actually have a lot of questions, and some of them might be a little bit worried about the process. So today I just want to show you how the Ultherapy treatment is done, on me, and maybe perhaps answer some of the more common questions that a lot of patients ask me when they come for treatment. So firstly, what's Ultherapy? So Ultherapy is a US FDA approved, non-invasive, micro-focused ultrasound treatment to stimulate collagen for lifting and tightening of the skin. So a lot of times it's done on the face, on the neck, and also sometimes on the body. So what it does is that it stimulates collagen through these small little dots of focused ultrasound, and in each of these small little dots of focused ultrasound there will be collagen which is being stimulated. The second question would be, how is Ultherapy different from, say, HIFU? They both use micro-focused ultrasound in order to stimulate collagen to tighten skin. However, the difference between Ultherapy and HIFU is that only Ultherapy is US FDA approved, which means that it is fairly well researched in terms of its safety, in terms of its effectiveness or efficacy. It also has what you see over here, a ultrasound scan of the skin, and therefore doctors are able to plan a little bit better when they use the machine in order to get a safer and also more effective treatment. So the next question will be, wow, doctor, how long does it last? I will put it this way. When we do Ultherapy and we stimulate collagen, the science tells us that collagen will continuously be produced over the next 6 months. But it is a really slow process. It is not surgery, it's not a surgical facelift. It does take some time. By and large, it takes maybe about 2 to 3 months before you see a fairly good result. And maybe the best results might even come in at about 4, even 5 months. And at 6 months, what you see is what you get. It's not going to improve anymore. Is there any fat loss when we do Ultherapy? I think that's pretty common, and quite a lot of people actually ask me this question. Well, there is no evidence that Ultherapy reduces the fat underneath the skin. Why? Because the focal point of Ultherapy at most goes to about 4.5 millimeters, which is very deep for a non-invasive device, but at the same time still pretty superficial compared to the biggest bulk of the fat that is within our face. There is a little bit of fat over there just mixed within the skin or just underneath the skin, but this by and large is superficial fat, which is really not very significant. The next most common question would be, oh no, it's painful, right? What do we do? So today, I already have taken some oral painkillers, and I've put a very thin layer of numbing cream on my face. It works pretty fast, maybe about 15 to 20 minutes. On top of oral medications and numbing cream, a lot of times we also use a cooler called a zipper cooler to cool down the skin during the treatment. Don't worry about the pain too much. It can and it will be handled. Next, what do I expect after the treatment? Is there any specific aftercare? Do I need to avoid the sun? Well, in general, ultrasound-based treatments and sun exposure is probably independent of each other. So you don't really have to avoid the sun. But in terms of having aftercare after Ultherapy, I don't think it really matters that much. In fact, it's supposed to be a non-invasive, no-downtime treatment. So you can go back to work, you can do whatever you want. When do I see the results? I have my wedding in 2 weeks' time. Will I be able to see the results? So unfortunately, the answer to the question is no. It does take some time. Although the collagen stimulation starts immediately after the treatment, there is also a little bit of immediate results from collagen contraction of your pre-existing collagen, but by and large, most of the effect comes from the body's production of new collagen. So today, I want to show you what goes through the treatment. I've really gone through some of the questions and answers of the patients that come through our clinic. So you can sit back, enjoy, and see how Ultherapy is done on me. Okay, so there we have it. I just had a 800 line Ultherapy treatment. I mean, frankly speaking, it's really not bad. I mean, it was okay. A bit long, took about an hour 15 minutes, but it really wasn't that painful. So we practice what we preach. Yeah, so good preparation equals a less painful treatment, and we'll just wait for a few months for the good results. So this is Dr. Terence Tan from Halley, signing out. Bye bye.